Hi, everyone. I hope that your June is off to an amazing start. Today, I will be going over what you need to know the forthcoming Board of Regents opioid education, training, and reporting policy. And I am Dr. Allison Smith, the program administrator for the Louisiana Center Addressing Substance Use in Collegiate Communities, LaCASU at the Louisiana Board of Regents. So I'm going to start with a bit of a brief historical overview of our office, the Louisiana Board of Regents, how we got here. Some of you will be new to our office and our services. One of the things that you'll be very glad of that this will not be a very data heavy presentation. So we'll do a lot of bird's eye view, big level picture things talking about the policy. Won't be too many numbers today. So the first up we have is our LaCASU history. Our office began after the 1997 binge drinking and hazing related death of Benjamin Wynn right outside the gates of LSU. And at that time, LSU was chosen in 1998 to participate in the Robert Wood Johnson's A Matter of Degree program, their AMI program to employ environmental norms to reduce higher rates of binge drinking. Throughout that funding, LSU was initially, our office started as the Campus Community Coalition for Change, the CCCC. When that funding was exhausted, we were at that time funded by the Louisiana Department of Health, Office of Behavioral Health, and Louisiana Highway Safety Commission. We are currently funded solely by the Louisiana Department of Health, Office of Behavioral Health. After spending 20 years at LSU, we moved from LSU to the Louisiana Board of Regents in July 2018. Some background on our office. I like to kind of put us in two buckets, that of a statewide focus and a campus focus, in which I'll talk about in a second. With our statewide focus, our office sits on three statewide policy groups: the State Epidemiology Work Group, the SO, the Prevention Systems Committee, the PSC, and the Heroin and Opioid Prevention Education Council, or the HOPE Council. All three of these policy groups report to the Governor's Drug Policy Board. And what they help to do is provide data and insight to help inform substance use prevention, recovery, treatment related policy for the state of Louisiana. Some of our background for our campus focus is one of the things that came out of the AMOD, or A Matter of Degree program at LSU. One of the grant requirable deliverables at the time was to create a statewide coalition. And some of the funding now that is currently sustained by Louisiana Office of Behavioral Health is our LaHEC coalition, which is what brings you here today. And so that is our Louisiana Higher Education Coalition to reduce alcohol, tobacco, and other drugs. And we have three main focuses there. We do research and evaluation, mainly through the Core Alcohol and Drug Survey, which you will not hear me talk a lot about today. Probably the only time you won't ever hear me talk a lot about that. Our technical assistance, which includes individual institution trainings, biennial review, or Drug-Free Schools and Campuses Act reviews for campuses. And then also we do regional trainings, which we'll talk a little bit about towards the end of the presentation. And lastly, one of our other big focuses is professional development, which brings you all here today. Every year we do a statewide summit that brings together all of our campus, law enforcement, student affairs, all of our student center folks on our campuses, along with the prevention community partners in treatment, recovery, all of those folks across the state, to solely focus on substance use as it relates to higher education. It's the only gathering like that in our state. I'm glad to say, thanks to the generous funding of the Louisiana Office of Behavioral Health, we've been able to keep that a free conference every year for our campuses and our community partners across the state. And although we're not able to meet in Baton Rouge this year, we are still able to bring you the content as well, because we also provide continuing education unit, which after each of these videos, if you all can take those quizzes, that is how we will track your CEUs. Right. So some quick history on the Louisiana Board of Regents. It was created by the 1974 Louisiana Constitution and began operating on January 1st of 1975, succeeding the Coordinating Council for Higher Education. There are 16 total members, 15 volunteer members called regents, who are appointed by the governor to a 6-year term, and one member appointed by the Louisiana Council of Student Body Presidents, or COS. So what COS does, all the student body presidents of all of our campuses throughout the state, they get together and they elect one person to serve as a student representative on the board. This past school year, we have outgoing new LSU alumnus student body president William Jewell will be going off to Vanderbilt for graduate school. He was our representative for this past school year. Policies and decisions of the Board of Regents are administered by a full-time staff and headed by the Commissioner of Higher Education, which is Dr. Kim Hunter Reed. We have a full slew of staff that kind of focus on everything, every aspect that relates to higher education. And so we kind of talk about some of the national landscape, kind of what's going on about opioids and kind of where we get to here, where we're talking about the policy today. So one thing is what's going on. A lot of the research we look at tells us that college students don't necessarily use opioids at the rate of the general public. That shows up in our statewide core survey data, in our regional core survey data, and nationally across other types of data sources such as monitoring the future, the NESTA data from SAMHSA. We have NIH data. We have the American College Health Assessment data. Different data sources all kind of show where college students typically do not indulge in opioids at the rate of the general population. And that is something that this policy aims to help keep low. So that is how we get here today. But what we see that, although not necessarily college students, we are starting to see an increase from other people in that particular 18 to 25-year-old age range, where we're beginning to see, this is a rapper by the name of Lil Peep who died from an opioid overdose. Another rapper by the name of Mac Miller who died from an opioid overdose. And another rapper by the name of Juice WRLD who died from an accidental overdose. And although these are all rappers and they're not college students, your college students absolutely know who these people are. And they're listening to them and they're being influenced. And so we definitely want to be sure we're putting out good content to help counteract some of the things they may hear. But it's not relegated to just one genre or one sect or demographic of community, because also the Angels pitcher Tyler Skaggs last year tragically died from an accidental overdose as well. And not again showing that opioid overdoses, misuse, abuse have no particular demographic that they seek out. Christian rapper Toby Mac's oldest child died of an opioid overdose last year in October. And then that's some of the bigger pictures, some of the farther out things. I know that's pretty far. That's not Louisiana, but what if I told you it was Louisiana? This is, and I mean, and for those in Baton Rouge, it's pretty close. It is a former Scotlandville High School football player who was found dead at the age of 22 from acute drug intoxication, mixing fentanyl and promethazine. And sadly, we're beginning to see there's been a lot of death around opioids. Again, it's increasing in this particular age range. Melissa Etheridge's son, Beckett Cypher, died at the age of 21 this month. Well, at the time of this recording, it's in May, died in May of an opioid overdose. And again, we see the same thing with the actor Logan Williams of The Flash, who died of a fentanyl overdose. Something that was particularly tragic about Logan's overdose, as all overdoses are tragic, Logan died at the age of 16. His mother shared in a New York Post interview that he had struggled with opioid addiction for 3 years. Doing some pretty easy math, that lets us know that he'd been struggling with an opioid addiction since the age of 13. So what we want to do is be sure that we're getting good content, good prevention out ahead, getting it to our students before they begin to use at the rates of the general population. As we kind of have our hands full with alcohol, marijuana, THC derivatives, cannabis, those kinds of things, vaping, we kind of have our hands full. We can't add any other balls to that right now. Additionally, again, knows no bounds. Opioid use knows no bounds. A House candidate in Arizona by the name of Chris Taylor, a veteran who was running for Congress, suspended his campaign after having a heroin overdose. So this is someone, again, in active use who is running for a statewide position. One, it knows no bounds. So being able to put good prevention out ahead of our students. And so this is going to be one of the very few data slides that we'll talk about coming up. And it's just to give you kind of a picture what some of our 30-day use looks like. We're the only thing we're pretty much higher than the national average on from the core survey data was the marijuana use, which has increased, unsurprisingly, I believe, across all campuses, regions, the state, and nationally. And amphetamine use. We are typically higher than the national average for amphetamine use, particularly in our southern regions. We're particularly higher. But if you see at the very last line, we have 30-day opiate use, which is 0.6, which is less than the national average of zero point 0.7. But right above that, you'll see cocaine. We're less than the national average, but we've continued to increase, and that's something that we're watching. Stimulants in particular, but for some of our campuses and our regions, cocaine is one of those things that we're watching. We're the marijuana number, I'll say this, is not surprising. We have seen a lot of our campuses say that's been their biggest increase. And throughout the regional trainings we've been able to do, doing the marijuana with vaping, the THC derivatives, those cartridges and things of that sort, something that's been pretty popular on the campuses as those passerbys are not able to tell what they're smoking in those particular vape devices. And this is what our regional opioid use looks like for 30 days. The only region where it increased was in Baton Rouge from 2017 to 2019, when it went from 0.06 to 1.0, which is sort of not surprising, as last year East Baton Rouge had its highest opioid overdose deaths reported last year. And so about our regional numbers, we only report regional data for regions that have at least 2 schools participating in that particular region. See the numbers left off on region for Baton Rouge, that is region number 2. And so we're going to talk about some of the national policy discussion and things that are happening. This is back at a meeting at the Office of National Drug Control Policy back in November of last year. The Office of National Drug Control Policy, the drug czar by the name, the president for that is the Director James Carroll. They gathered some campus community folks. They gathered people from all various sectors across the spectrum, and they wanted to know what could they do to curb the opioid overdose. What could they do to curb opioid use rates? One of the things we talked about with college campuses is, although our numbers are not as high, we need to educate and do great prevention on the front end so that they never get that way. And so one of the things we also discussed there, when we're sitting at the table with the ONDCP, that's headed by the Office of the Executive Office of the President, we talked about having national, university, and statewide leadership on this particular issue. And one of the things being able to push good policy forward, and that's something that's become central that we will talk about throughout the presentation. And you see me sitting with my best friend, Surgeon General Jerome Adams, right there. We were seatmates. And we got to spend a lot of time talking about some of the great work they're doing now over in Louisiana, and some of the great time. He had just spent some time with Rebecca Gee at the time, but right before she departed. And so one of the things we know that there was definitely a buzz going around doing something legislatively or policy-wide when it came to opioids, whether that be the individual campuses doing something, whether that be the systems, whether that would be the legislature, would that be some kind of policy, what would that look like, and where would that come from? And so one of the things that Louisiana Department of Health decided to do is that in looking at their overall approach to providing great prevention around the topic of opioids, they were very thoughtful in wanting to include the collegiate community, making sure that we never see the rates that other sectors of our community see. And so at the time, the then Secretary, Dr. Rebecca Gee, approached Dr. Kim Hunter-Reid, our Commissioner for Higher Education, to have a discussion about what that could look like on our campuses. And then additionally, Dr. Kim Hunter-Reid, during the meeting, one of her regular meetings with our assistant presidents and representatives, they brought up the issue as well as something that they would like to look at. Some campuses were beginning to see spikes or incidences with particular opioids that they weren't like, we see that this may become a problem. We would like to stop it on the front end. What can we do? So this is something that our state is trying to be extremely proactive on, as there are only a handful of maybe 3 or 4 other states that have statewide policies for all of their um, higher education institutions. And so that is something that we're excited about being able to do in a thoughtful way that allows our students to get great education while keeping them safe. And something that was very important to me personally was not making it such a heavy lift for our campus partners to implement. And so when I mentioned our system heads, we have 4 public management systems in the state of Louisiana for higher education. And so some of you may not be familiar with them, and I'd like to share who those are with you. So the Louisiana Board of Regents governs all of our public systems. So we have Dr. Muncie Sullivan, who is the president who is over the Louisiana Community and Technical Colleges system. We have interim president Tom Galligan Jr. over the Louisiana State University system. Dr. Ray Belton over the Southern University system. We have Dr. James B. Henderson over the UL, University of Louisiana system. And then for our private institutions, there's an association called LaCASU, the Louisiana Association of Independent Colleges and University. And we have Dr. Kenya Messer, who represents them as well. And so all of these systems and associations were involved and had opportunity for feedback on the creation of this policy and to help shape and designate a representative for their system to provide feedback. And we definitely got a ton of feedback, pages worth of feedback that we sat down and we worked through for hours, and to be sure that we did something, one, that kept students safe and that educated our campus communities. Again, when I mentioned there was legislative interest, there were a couple of bills that were pre-filed. One of them was by Senator Patrick McMath from District 11 with Senate Bill 51, which would have required each full-time university or college police officer to carry a supply of opiate antagonist nasal spray in its official vehicle. And another one was by Senator Gary L. Smith of District 19, Senate Bill 206, which would require each public post-secondary institution to implement an opioid overdose response plans. Both of these bills are pending in Senate Education at the time, with the intent that they will not be filed, that they're pending there. Um, I have 2 more people listed on the bottom. One of the interests that they show. Senator Regina A. Barrows from District 15 sits on the Hope Council with our office as well. And that was one of the things she brought up, that the Hope Council should look at, making sure we, at the minimum, equip our campus law enforcement with opioid antagonists in the case they have to respond to an overdose. And I think we've gone a little further than that. And then we have Rep. Nicholas Muscarello Jr. from District 86, who one brought up the issue because of some concerns from constituents in his particular district. But one of the things that we had in common with all 4 of the state elected officials that you see before us is that they all agreed to defer to the Board of Regents policy, as our policy was extremely intentional, very thoughtful, and very comprehensive. And our policy has funding attached to it. And so that was one of the things that was important to our office, to be sure that we could get some funding to make our policy as feasible and as easy to implement as possible. And so one of the things, those bills, Senate Bill 51 by McMath and Senate Bill 206 by Senator Smith, that are pending in Senate Education. Part of the reason why they're pending right before COVID-19 interrupted the way that we meet and do things at this time, we were going to have a conversation over in Senate Education, so that one, they wanted everyone to know that we're looking at doing something on this issue, but there's already a policy being developed. And so they were going to have their bills read out in Senate Education so we can all have a discussion and we can share what we were working on from the Board of Regents. But after having conversations with them, they were very excited about the policy that we're discussing today. And so the policy, as it stands now, at the time you may be hearing this recording, the policy is set to be passed at our June 2020 Board of Regents meeting. And so I'll talk about some of the things that we got when we talk about feedback and some of the things we worked on to tweak the bill. Okay. So one of the things four things kind of showed up repeatedly for our feedback that we got. So all of the camp, all five of the systems and associations were instructed to provide a designee to the Board of Regents to work on the policy for their system or association. Within that, that particular representative had leeway to solicit feedback in any way that they so chose, which may or may not look the same across campuses. And so the things that we came back, a lot of times the system rep sent it out to all of the campuses to get feedback on it. The big things we came up with were funding, access to training, participation refusal, and reporting requirements. And so as we move throughout the rest of the presentation, we'll discuss all of these things and how we've worked to be sure that none of these things become a barrier to implementing the policies. All right, so the first piece was I'll talk about the components of it. There are three main components, and as titled in the presentation: education, training, and reporting. And I'll go through each of those. So the main thing with the education is that each campus will be responsible for providing a campus-wide awareness campaign that focuses on substance misuse and abuse prevention education, as well as open campus overdose training to engage students. And what we're basically asking is, one, if there's trainings on your campus, allow not only just your students, but your local governing entity and your community members to attend that training as well. So one, we can, again, as beacons of knowledge in our particular communities, we can begin to share that as well. Um, and doing something simple as social media campaigns or stall seat journals or scrolling through closed circuit television on the campuses, being able to get awareness messaging out. And there's some free resources that are available for that as well, where you don't necessarily have to reinvent the wheel, particularly with Generation RX, which we will talk about in the future. And so one of the other things, again, this is included but not limited to email, social media posts, posters, substance misuse prevention education for all of those to engage students. And one of the things that we talk about engaging students, we really are encouraging campuses where they have students enrolled in health, social science, or behavioral science profession programs. For example, pharmacy, medicine, nursing, allied health, social work, psychology, and sociology, or student organizations such as student government, health promotion, and Students for Sensible Drug Policy should be engaged to promote awareness and education with the goal. Because one of our main goals is to stigmatize provide education that destigmatizes seeking help. We want to encourage help seeking behaviors for those who may have a problem, and then also stigmatize the misuse and abuse of opioids and to help prevent overdose deaths. The next component is naloxone training, naloxone administration training. And what this training must cover is information on relevant policies and laws, annual training conducted for designated job descriptions, that it must be stored in a reasonable, accessible location, and participants must be told about the decline to administer option. And so I kind of go into detail about each of those. Our state has a standing order for naloxone that you don't need a prescription to get it, that it's not a controlled substance, that you don't have to have it locked up, that you can literally walk into a store and purchase, or you can get it free from some type of community agency, wherever or anyone else who is handing them out. Um, we also have a Good Samaritan law for naloxone administration that protects first responders, as well as Good Samaritans acting in good faith. And then we also, when we do our regional trainings, we provide information on all of these things, and we have resources to provide for our campuses when they do the training. Because additionally, the training also cover how to recognize an opioid overdose, the proper procedures for storage of the and the administration of the naloxone, and then the directive to alert emergency medical services whenever an overdose is suspected, whether or not a person decides to administer naloxone. I'm going to say that part one more time. It has to include the directives to alert emergency medical services whenever an overdose is suspected, whether or not a decision is made to administer naloxone. And so, one, we also know that sometimes when a person receives a shot of naloxone, They receive both sides. We will be providing the nasal kits, the Narcan nasal spray kits, that they may need more than one kit. And so even when it's administered, we want to call. But this leads right into the decline to administer. One of the things that came up, we had some feedback from our campuses, is that even with educating them about the Good Samaritan laws, which some of them didn't know existed at the time, but if they did not want to administer. And so the way that the policy is written is that no one is required to administer Narcan, but certain positions are required to be trained. So what that means is, for those people, staff, and so our people who will have to be trained include the staff living in student residential housing, whether they are full-time, part-time, graduate, or undergraduate, including Greek residential facilities, which are commonly P3 facilities, public-private partnerships. Students living in those facilities will be required to be trained. Campus law enforcement, those who work in health, wellness, and counseling centers, including those at remote counseling and mental health facilities. So let's say your campus has a counseling center in the center of campus for all student use, but there's also counseling services in athletics. They will also have to be trained, those who work in athletics counseling. Um, this will also go for pharmacy and staff interns, athletic training staff, and collegiate recovery program staff and students. Additionally, when we say, one of the things we came up with, we talked about going back and forth. Again, we had a lot of discussion with our campus partners with this, talking about where to store the naloxone, because one, it's not a controlled substance. It does not have to be securely locked up. But one, we made sure to give our campuses leeway and discretion of how they make this available on their campuses. So one of the things is that it must be in a reasonably accessible location. So if let's say I am in the White House. If I am standing in the White House, a reasonably accessible kid is not at the Louisiana State Capitol. It has to be somewhere that can be quickly retrieved in the event of an emergency. And so, again, there's no designated one spot that they all have to be. We just talk with our campuses, our system reps, and ask that whatever that spot, that designated spot be, that those who are trained have to know what that spot is. So if there's a RA desk that sits on the third floor where there's always someone sitting there, whoever sits at that desk, and then let's say you decide to keep your Narcan in the third drawer on the bottom right, that's fine. Everybody just needs to know through in the training that it's in the third drawer on the bottom right. It has to be a known location that's easily accessible to those for a time of distress or emergency. And again, I want to reiterate that all certain staff will have to be trained, but they can decline to administer. There is no penalty. There is no threat of retribution or anything. So one of the things we want to always remind, and including the training, is to always call emergency medical services, whether that is your on-campus police, whether that is your contracted police service, 911, but always call emergency medical services, whether you administer or not. And so I mentioned that our local governing entities earlier. One of the resources for our campuses that it's a fantastic resource that can help you with naloxone trainings for your campus, naloxone administration trainings, are your local governing entities. And what those are regional Louisiana Department of Health offices. And so for Region 1, we have Metropolitan Human Services District, which services, we typically lump Metropolitan Human Services District and Jefferson Parish Human Services Authority together as a greater New Orleans area, because we know our students live all over the city of New Orleans, and they work very well together. And it's always a joy to partner with both of those LGEs. And so they serve as that particular area down in New Orleans. In Baton Rouge, we have Capital Area Human Services District. In the Houma Thibodeau area, that was Region 1, and Region 10, Region 9, Region 10, I'm sorry. for Jefferson Parish and Metropolitan Human Services. Metropolitan is District 1, is Region 1, and Jefferson Parish Human Services is Region 10. That's for New Orleans. Region 2 for Baton Rouge is Capital Area Human Services District. Then we have Region 3, which is South Central Louisiana Human Services Authority over in yellow. Next, we have in green Region 4, the Acadiana Area Human Services District, followed by Region 5, Imperial Calcasieu Human Services Authority in the Lake Charles area. And then we have the Central Louisiana Human Services District over in Central Louisiana, the Alexandria Pineville kind of area, followed by Region 7, Northwest Louisiana Human Services District, mainly Shreveport, that kind of metropolitan place, and followed by the Monroe area over in the light purple with Northeast Delta Human Services Authority, and rounded out by Region 9, Florida Parishes Human Services Authority in the dark purple, which serves the Hammond Tangipahoa area. If you are a campus representative and you do not know who your regional, your LGE, your Louisiana local governing entity, where they are, or who you should talk to there, or who you should connect with, please email me at allison.smith@laregents.edu, and I'll put my email up at the very end. But we have amazing partners right in your backyard who do amazing work, who can assist you in those things. Again, if you do not know who your LGE person is, who would be able to come and do some of those trainings for you, they already do a ton of them in your community, and they would love to partner with you. And I can get you a name and a list for those people at those particular respective LGEs. Because I know you all love a ton of paperwork, right? The next thing we have is reporting. That is the last component of our policy. We have two reporting requirements. The first is that naloxone administration must be reported to a campus's management board within 72 hours. So when I talked about the systems, the LSU system, the Southern system, the LCTCS system, the LaCASU system, and the UL system, those management boards, if you are a campus and you administer naloxone on one of those kits, you need to let your management board know within 72 hours. And then from there, they will handle reporting to the Board of Regents. That's something that they will do on the back end. And then there will be a quarterly report of administration submitted to the management board. And so one of the things we have with the quarterly report, all that will be is list, if you had 0 administrations, you can literally just affirm that we had 0 administrations, and that's all. Trying to work on keep the paperwork to a minimum. One of the things we discussed with the system reps is if we can revisit this. This was right before COVID-19 kind of interrupted our semester. Is that if it is helpful for our campuses, and I hear that it's helpful for them, we can create a standard reporting form, or the systems may want to create a standard reporting form for them as well. So some of the information that we will collect from that particular reporting form, or particularly demographics or incidents about the naloxone administration or the event that happened. So that way we can begin to track data on where we may or may not have a problem. So some of the information that the report will include is the date of the incident, the location of the incident. So whether if it's in the stadium or a bathroom, a residential bathroom, a Greek housing, in the student union, in the rec center, the access point of the naloxone kit, where was the kit retrieved from? Where did you get the naloxone from to administer to that person? One of those things is that way we can also replace the kit. If that kit is used, we need to know so that we can replace that particular kit. Then the employment category of the person administering naloxone, whether it was one of your residential staff members, a campus law enforcement, or athletic staff. The race and gender of the person who is administering naloxone. And so when we're not asking for any identified student information, just the race and gender, and then also any resulting follow-up action. So if campus law enforcement would call, if there were arrests made, those types of follow-up actions, or if there was a policy change, or whatever happens after that, we would like to know. And so we can work on keeping the reporting. We're trying to keep them as minimal as possible. And that's something we can revisit with the campuses. in our systems if they would like us to create a standard form or if they would like to do one individually based on their systems. So now we'll move on to the implementation. And so the policy, because everybody wants to know, our semester has kind of been upended. We've kind of lost some time, but what do I need to do to meet the policy? Pending approval in June at our board meeting, we are slated to implement the policy for fall 2020, beginning in fall 2020. I'm giving away our semesters moving. There may be a bit of grace there, but we're slated to implement in fall of 2020. And so one of the things, what are the main things we need to each campus to have to meet the minimum requirements for our policy? The first is providing educational information on the dangers of opioid misuse and abuse to your campus community. Provide naloxone administration training to specified campus community members. And report any naloxone administrations through established reporting channels. So whatever your particular management board or campus sets up as the reporting structure, following those. And so one, we're going to kind of talk about how, particularly with the educational component, how we can help the campus meet those particular needs. We talked about with the naloxone administration trainings, utilizing our LGEs, our local LGEs. And then also they provide train the trainers. So it's pretty easy to learn how to administer. And then you can have trainers on your own campus who provide that training as well. And so again, I mentioned earlier that one of the other things was cost, because of course everybody wants to know how much it costs. So we have been able, through a partnership, amazing partnership with the Louisiana Department of Health, Office of Behavioral Health, to secure funding for the first and second rounds of naloxone. And so the kits last about 18 months for a shelf life. And so that's about 36 months worth of kit life. And so what we're doing is we're looking and we're actively working. And I say I am actively working every single day to collaboratively work with our partners throughout the state and the legislators to find some funding for this important policy. So beyond that, we can continue to provide that for our campuses. Additionally, with forest training and education, we've been doing Generation RX training with our regional trainings that we were able to complete. And we've been providing training manuals to our campus partners and our community partners who attend at no cost. And so again, for campuses who did attend the training already, if you were unable, if you need more manuals, you can request more manuals from our office. And for those campuses who are not able to have a regional training in their area, we will work on mailing once we all kind of figure out where our fall semester looks like, where it falls. We will work on getting those to you as well. And so we can talk about some of the technical assistance that we can provide, kind of going more into the Generation RX and how we can help get some training in the education piece awareness done on our campuses. So one thing I'll mention, well, wait a second. So one of the things we know that opioids are where our current funding nationally, a lot of the funding is there. But again, I mentioned that college students don't necessarily utilize at the rates that other groups of people do. And so what they tend to utilize is, from the college prescription drug study from 2018, is stimulants. That it by almost 7 percentage points, it's higher utilizing stimulants. And that's legal or illegal. And so that's things we're talking about, particularly if here is legal. Legal stimulants, talking about Ritalin, Adderall, Vyvanse, those types of drugs. What's considered typically study drugs. And so one of the things that was very important for us is that whenever we talk about opioids, we would talk about stimulants. Because one of the things is that we realize is that students don't necessarily recognize drug classifications. And so some of those commonly misused drugs, under some of those recognizable names, so like Vicodin, Oxycontin, or Lortab. So I've had students tell me, I don't take opioids, like I don't do the whole opioid thing, but they take Lortab. So those kind of things, not making the connection that that's an actual opioid that I could become addicted to. And other things. And what also one of the things educating them on, we'll talk about is proper prescription drug use, because also we get to the presence, Valium, Xanax, those types of things, Cymbalta, Ambien, those types, Lunesta, those types of things that are very commonly misused among college students. Because one of the things that the training we talk about with Generation RX helps them to understand that drugs, whether they are illegal or illegal, sedative or stimulant, weak or strong, all trigger a chemical reaction in the brain to release the feel-good hormone dopamine. So your body doesn't know if you took something legitimately, or if you found something on the sidewalk and decided to consume. Because what we know, given the chemical structure of OxyContin and heroin, they are almost identical. And that the vast majority of heroin users started misusing prescription opioid first. And so that's where we begin to see the increase of states adopting prescription drug monitoring programs, where you used to get certain medications from your primary care doctor for a 30-day supply. And then it went to a 14-day supply, then a 7-day supply. And now you have to be referred to pain management. So like if you go to urgent care, if you have an acute injury, something that just happened one time that's causing pain, typically you get, even if they decide to give you an opioid or some type of strong pain medicine, it's typically for no longer than 10 days. Because at that point, they feel you should be able to go and see a primary care physician. And if necessary, they will refer you to a pain management doctor. Again, because the body, it responds the exact same almost to OxyContin and heroin. And so if becomes harder to get the prescription drugs, people will very often go to the next closest thing that produces almost a very similar reaction in the body. So how can we help? One of my favorite slides, because it is absolutely my job and my pleasure to help assist our campuses in implementing policies and programming that will help keep our college students safe from substance misuse and abuse. And so one of the things we've really been having some good luck with, some good feedback with is Generation RX, which pushes four key messages that teach students to only use prescription medications as directed by a healthcare professional. Do not share or take someone else's medication. Keep your medication safe, and to model safe medication practices. Generation RX it's created by the College of Pharmacy at The Ohio State University, and they have created amazing toolkits. And what those are, they are audience specific packages of media information for different audiences. So there's one, we utilize the university toolkit for college students, and we also utilize the adult toolkit for talking to parents at orientation and things of that sort. But there's also a kit for elementary students, for teenagers, and for older adults. Older adults, typically those more senior parts of our population. And then they also have one for providers, how to talk to providers about talking to their patients about safe medication practices. And everything that they offer is free. The only thing it costs you is your email address to sign up, so that they can email you if there's a change in one of the kits or an update to a kit. And again, we've created a manual. We put together a manual that we have for our campuses that we've been distributing at our regional trainings, and we have some for you for our 4 cities, for the Hammond training, the New Orleans training, the Home and Thibodeau training, and the Alexandria training that we had to cancel due to COVID. We have some materials for you that we will work on getting those to you when you all are safely back on campus. And so one thing about the Generation RX program, it is amazing in the way that it's a train-the-trainer model. And they partner with 115 colleges of pharmacy worldwide, including the Xavier University College of Pharmacy in Louisiana and the University of Louisiana at Monroe, their College of Pharmacy. And they have some amazing pharmacy students that are going out training people in their community, their local community, about safe medication practices. They've directly educated over 2 million people with an environmental impact of over 55 million, and trained 88,000 facilitators, including yours truly. And they've won multiple national awards. Again, and it's very partnership driven. So A lot of my higher ed folks will recognize the big green United States over there with NASPA written over there. There's those 4A, they partner with 4H. They partner with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, which replaced the Higher Education, the Department of Education's Higher Ed Center, which many of us know and loved. And they work with Girl Scouts as well, and teaching young girls about safe medication practices. And again, echoing that theme, we see Zeta Tau Alpha. They've nationally partnered with them to provide safe medication practices for all of their chapters. And one more partnership, Pi Kappa Alpha, they've signed a partnership agreement with them to provide training to all of those fraternity chapters as well. And they're looking to work with more fraternities, sororities that are willing to partner. So as I mentioned our regional trainings earlier, although we had to cancel some, we were able to get to a few cities. So we were able to get to Baton Rouge, where we partnered with Capital Area Human Services, who did an amazing job providing naloxone administration training, Narcan training for our audience there as well. That was back in on February 11th. February 18th, we went over to Lake Charles and we worked with Imperial LaCASU Human Services Authority over in Region 5. And again, they did a phenomenal job providing Narcan administration training. Then we headed up over to Shreveport on March 3rd, I believe March 4th, I believe. And we had a partner with Northwest Louisiana Human Services. Again, they provided an expert community partner who did an amazing job on naloxone demonstration there as well. Then took a dead evening trip over so I could be in Monroe the very next day on the 5th of March. And again, phenomenal presentation by one of our community partners, partnering with Northeast Delta Human Services. Again, being able to partner and collaboratively work with all of our campus partners and the community partners in that region. And again, we went over to Lafayette area. That was the last training we were able to complete on March 11th, working with Acadiana Human Services District over in Lafayette. And what was, again, cool, we had all of our schools there with our community partners. And the reason why those partnerships are so important, because after all of these trainings, well, probably except for one in Baton Rouge, I went home. So my job is to help establish those partnerships so that you have someone to call for our campuses. You have someone to call. You have community partners that you can lean on. And then for our community partners, that you have a way into the campuses, because those students don't just stay on the campuses. They work, live, and play in our communities. They go out, they spend money, they hang out in our community. So it's not just like those are just the students for that campus. They're all of our students in our communities. And so I know some of you were sad. We had a lot of people registered for our remaining 4 trainings, a lot of excitement. But unfortunately, due to COVID-19, we had to cancel the remainder of our trainings, including the one that was scheduled for Hammond, New Orleans, the home of Thibodeau area, and Alexandria. So what we decided to do, because we're not sure when we'll be meeting in groups, large persons again, we will be working to set up, I know you're tired of Zoom, but trust me, hear me out. We'll set up some interactive Zoom. We'll do some Zoom sessions. We'll work on a time that we're able to provide the regional training via Zoom, so that one, you're able to get the information that all the other regions got. You're able to get your continuing education units, because we still get those as well. We provide those for our regional training. And then also you're able to be prepared and equipped so that you're able to educate your campus community as well. So some of the resources we have, that I want to be sure that there's a ton of resources, but one of the first ones is generationrx.com. They have an amazing website. Again, all it costs is your email address so that you can download the toolkit. They have tons of resources, scripts. A lot of that we have pulled to put into a binder, which I felt best represented what fits our students here, but you're welcome to print out some of the other materials that they have. But the binders, we can get those mailed out to you again. If you did not receive any, or you need to order more, because it's a train the trainer model, Generation RX. So you can train peer educators, student leaders, student government associations, any students that train others, any RAs, so that they can train other students and deliver that information. Because we know, as awesome as we all think we are, students tend to listen better to students. And another resource is your regional local governing entities. Again, if you need the information for that local governing entity, please send me an email and I will get that information to you. I've been working with these people for most of them for the better part of 10 years. And so it's been an amazing way that they're always ready to help and always be helpful for our campuses. So if you need additional assistance, I'm pretty sure I can speak for them saying they're more than willing to assist, as they're working very hard day in and day out to help keep your community safe as well. And then lastly, there's our office. Anytime you feel the need that you have questions about the policy, the implementation, so whether that's the education components, the training component, or the reporting components, please feel free to send me an email. Don't call me. We're probably not in the office yet. We're staggering our way in, but the best way is to send me an email, which I will put up at the end of this. But those are the top three resources I would recommend for you for the implementation of the policy. And again, if you have any questions, please reach out to me. And lastly, before I get out of here, I want to say thank you. I want to say thank you for always doing the work that you do so thoughtfully, so intentionally, in doing the work of you when a ton of things were going on around you, beside you, maybe inside of you, but you still showed up for our students all the time. And you pulled off an amazing semester. We're hitting the summertime, and it's my hope that you all stay safe and that we will convene again one day in person. But until then, we will all have Zoom fatigue together. So thank you for everything that you do. Um, Forthcoming will be an evaluation that will go out on Tuesday, June 23rd. For everyone who registered, there will be an evaluation that you will have until midnight on Friday, June 26th to complete. And one of the things I want to encourage you to do is to complete the evaluation. What we use those evaluations to absolutely design the programming that we bring to you. Last year, one of the comments from our annual summit was that they wanted to see something that was focused specifically on community colleges. And that's where our basics session came from this year, looking at adapting basics for a community college campus. So we really take those into consideration. So one, I encourage you and I implore you, please fill out the evaluation. I know you have a lot of emails coming, but check your spam folder on. If you don't get the email by 10 a.m. on Tuesday, June 23rd, check your spam folder to see if it's gone in there. But we definitely want to hear from you so that we can continue to provide you with more training, more relevant programming that helps aid in the work that you do. Additionally, one of the things that you will see coming from our office, given this time that we're in where we're kind of not allowed to meet in large groups, you'll begin to see more webinars, more live webinars, Zooms, or recorded training. So if you have any suggestions, any topics, any speakers that you would like to see, feel free to send me an email. And you can do that at allison.smith@laregents.edu. That's ALLISON .smith @LA Regents LAREGENTS.edu. Again, that's any questions about the policies, any type of programming you would like to see, any type of topics you would like to hear, or any type of speakers you would like to hear from. Again, thank you for your time, for your commitment, and please stay safe.